Welcome to our special show, Health and Wellness Myths and Facts. Health monitoring is very important in terms of prevention, particularly in the early detection of diseases. This can reduce suffering as well as medical costs. The diagnosis and prompt treatment of various diseases can radically improve alternatives for medical treatment of the patient. Now, regular monitoring of blood glucose or blood pressure can save patients from long-term complications. COVID-19 changed everything about healthcare delivery in the last 2 years. Innovative care and solutions were sparked by the desire of patients to avoid unnecessary exposure to COVID, along with an interest in reducing the cost of travel and avoiding long waiting times while increasing communication with clinicians. The new technologies, there come many confusions regarding it. So let's talk to experts and clear all of these confusions. We have with us Dr. Sibyl D. Brito, consultant diabetologist, Dr. Sibyl's Diabetes Care Clinic, Nalasopara, Maharashtra. We have Dr. Sudeep Saran, consultant physician, Saran Hospitals and Institute of Paramedical Sciences, Bareilly. Thank you both very much for being with us. Dr. Sibyl, to you first, what is the treatment or the approach for newly detected type 2 diabetes patients? And, are there any kind of specific guidelines for it? And are these different for people who've been detected with diabetes post-COVID infection?
Thank you very much for having me on the show. So type 2 diabetes is a lifestyle illness. And having said that, lifestyle modification is the first thing that we target in the treatment of new patients. We do have guidelines, the ADA, IDF, RSSDI guidelines. And if you look at these guidelines, at the heart of all these guidelines is lifestyle modification. So what we basically do is we advise patients to have a balanced diet, which is high in proteins and fibers and low on fat and carbohydrates. We encourage them to have some form of physical activity in the form of exercise, and then we suggest them ways and means to reduce their day-to-day stress levels. And what we see is that there is very good improvement in their blood sugar levels after successfully addressing the lifestyle changes. And over and above this, we optimize the drugs and medicines for them. Now, coming to the second part of the question, the post-COVID diabetes could be of two types. We see either a pre-existing type 2 diabetes, which is unmasked by the infection or treatment of COVID. And then there is de novo diabetes, which is because of the virus affecting the pancreatic cells per se. In either of the cases, the treatment and presentation of the patient remains the same. But what we need to look at is that in the post-COVID scenario, the patients are low on immunity, and therefore they are at a higher risk of developing complications like mucormycosis. And in this scenario, we try to target the sugars more vigorously, we treat them more vigorously and bring them under control as soon as possible.
Right. Dr. Sudeep, the number of wearable devices has risen in the past 5 years. Generally, cardiology-related wearables include, fitness trackers, digital blood pressure cuffs, weight scales, to even arrhythmia monitoring systems. Are these technology solutions trustworthy and should they be used?
Good afternoon and thank you very much for inviting for the session. These modern gadgets, they are very, very important because I feel it is not to diagnose the decision to take the treatment, but the most important part to have a successful treatment is the monitoring, like blood glucose monitoring, blood pressure monitoring, and the ECG monitoring and the tracing monitoring. Now you see there are two advantages. Number one, it gives, whenever you are monitoring daily 3 times or twice daily, it gives an awareness to be more strict toward the treatment profile, number one. Number two, if there is an irregularity, you can contact your doctor to adjust the doses, because all the time with the weather there is a change in the doses according to the stress. You need to change into the doses. So the warning that you are not doing well with the vitals, you are getting by the modern gadgets which are available. As past second thing, you have talked about the cardiac arrhythmias. You see, cardiac arrhythmias is in a very serious emergency that takes a matter of few minutes. Like if we'll talk specifically, ventricular tachycardia, ventricular fibrillation, and cardiac arrest. These situations cannot be monitored, cannot be judged clinically, only the ECG. Of course, for a layman, ECG is nothing because it is on a graph, but at least one can see the graph and can make it out there is some irregularity in the pattern of the graph. Now, he cannot do anything after seeing the ECG, but by the WhatsApp, by the telemetry, can contact his doctor immediately. So at home, he can have the treatment, as well as when he being shifted to the higher center, during that period, he can be offered the treatment specifically for ventricular tachycardia, ventricular fibrillation, and those emergencies which never takes minutes, because in the past you might have heard few news where there are certain prominent persons, they were young, they were doing the gym, and so they collapsed all of a sudden. So the ventricular tachycardia was maybe one of the cause for that. So it's, these gadgets, they are very useful for monitoring and in the stress situation to provide the proper treatment as early as possible, even while during transportation reaching to a better setup. Thank you.
Right. Dr. Sybil, the traditional way to monitor blood glucose levels has been, throughout with that fingertip prick blood test. But speaking of, new technology now, people with uncontrolled diabetes, they may need to have multiple tests in the day. Can CGMS therefore be a good alternative to this?
Yes, we have enough evidence now to prove that stable and well-controlled blood glucose levels goes a long way in preventing the complications of diabetes. And having said that, regular monitoring of blood sugars is equally important to achieve this goal. So, but multiple pricks, as you said, are not something which people like to do. So CGMS comes to the rescue. So CGMS is basically continuous glucose monitoring system. It consists of a sensor which is inserted under the skin, either on the elbow or any discrete part of the body. And as soon as it is inserted, it starts tracking the sugar levels every few minutes, 24/7. So depending on the sensor, it could work for 7 days, 14 days, or even a month. Then there is another device which is called as a reader. This reader collects all the data from the sensor and interprets it in the form of a graph. Now, if you think about it, it's a beautiful technology because we can see our sugar excursions over the 24 hours. And we can see when the sugar was high, when it was low, how our body is responding to exercise, how the sugars are responding to a particular type of food. And when you look at, for a doctor, this information is invaluable in preparing a tailor-made treatment plan for the patient. Now, CGMS is not uniformly recommended for everyone. There are specific recommendations like patients who are on insulin pump, patients who are requiring multiple dosages of insulins in a day, patients who have high fluctuations in their sugar levels, and in cases where strict sugar control is desired, for example, in pregnant ladies or post-operative situations. So this is when CGMS is very useful.
All right. Speaking of ECGs, Dr. Saran, the availability of portable and home-based ECG is, considered a very important medical innovation. Now, this is something that has the potential, to actually transform medical care. But the question is, how accurate are the readings and is it user-friendly?
First of all, I must congratulate you because your questions, they are very appropriate according to the situation, like I was specifying after the COVID. As far as this thing as authoritative is concerned, look here, ECG gadgets, they are available, even available on the mobile. On the mobile, the electrodes are there. Just you put your thumb and you can get the idea of the tracing of your ECG. A simple man cannot decipher the ECG, but he can at least make it out that it is not a normal pattern, there is some abnormality. You see those cases who has got the coronary bypass surgery, who has got an angioplasty or any cardiac implant, they are very prone to have any alternation in their ECG pattern at any time. If a person is doing the home monitoring, he can pick up the things early, because the tendency is once you have got done the bypass or angioplasty, you see that you are always safe, but that's not the truth, because heart is in a structure which can have any abnormality at any time, and early detection is the success of the treatment policy into the cardiac situation. So these household gadgets of the ECG, they are reliable, they are authentic for a layman at that time of the emergency, and they are very, very useful gadgets to be used, because every minute is precious at that time of the emergency.
Right.
You can connect your doctor, show a pattern, and can use them very well.
All right, Dr. Sibal, there have also been reports of development of artificial pancreas. Now, a couple of allied questions. Can these actually help to cure diabetes? What are artificial pancreas, if you can explain to our viewers, and how promising is this new advancement, and is it even available in India?
Yeah. So pancreas is the organ in our body which is responsible for maintaining blood glucose levels by secreting insulin and glucagon. And it is the organ which is primarily affected in diabetes. And artificial pancreas is a system of devices which functions similar to a healthy normal pancreas in maintaining blood sugar levels. So most of the artificial pancreas systems consist of three types of devices. We have the CGMS, which is a glucose monitoring system. We have an insulin delivery system like the insulin pump. And then there is a computer algorithm which interprets the data from CGMS and does some calculations like artificial intelligence, and gives the dosing instructions to the insulin pump so that the blood sugar levels are maintained in real time. These kind of systems are also called as bionic pancreas or closed loop systems. Now in international market, these are quite accessible, but in India yet FDA approved devices are still awaited. And some tech savvy people have managed to connect the CGMS to the insulin pump with the help of locally developed softwares. But the technology largely remains unaffordable and expensive for common man. Now, hopefully, but the people who have used these devices, the type 1 diabetic patients, they have given a very encouraging and positive feedback about this, because it empowers them in terms of their disease control. And hopefully in coming years, we will get better technology, more safety data, and maybe affordable technology which will be easily accessible to the masses.
All right, important clarifications there by the doctors. On that note, we're going to slip into a very short break, but our panel of experts will be live with us on the other side. Stay with us. Welcome back. You're watching Health and Wellness Myths and Facts. Dr. Sudeep Saran, if I can come back to you at the moment, cardiac procedures can be very stressful, and after discharge from hospital, patients are usually, put on some kind of a cardiac rehabilitation program. What role can technology play to help monitor these people, their vitals regularly, and which things should they actually be looking to monitor? What are the parameters?
After the break, again a very good question, Madam Bayu, and I think all the questions, they are very useful for the cardiac patients who have been subjected for some cardiac procedures. I'll answer into the two parts. First of all, immediately after this coronary intervention, whatever it is, the first thing is this: a patient goes into the depression. So the counseling, encouragement by the family members, a proper explanation by the doctor that now you are any element free because your tubes, they are open, and assured just that you have got a normal life. That assurance is very essential. This is the immediate thing, and after that, according to the instructions, he must go to the gradual increment in the exercise. So within a month, he will be all right. I will forget about that he has been a cardiac patient. Number two, in a long-term monitoring, what is the thing supposed to be monitored regularly is number one, the blood pressure, blood sugar, lipid profile, and subsequently after that, every 6 months, he must get done his echo to see the real status of the cardiac, and whenever after every year, he must go to the thallium scan to see the status of the perfusion in the remaining heart according to the advice of the doctor. And if in between there is some chest pain, doctor can recommend also the TMT as well as the cardiac markers which are available into the market nowadays in the different labs, including the lipid profile, uric acid, lipoproteins, apolipoproteins. There are so many markers are there. So, but everything has to be advised by the doctor and to be followed. So, immediate rehabilitation and late rehabilitation both have been taken care of accordingly, and all the modern gadgets they are very helpful in doing all this monitoring.
Right. So big thumbs up there for all the modern technology that is really available at the moment. Dr. Sibul, when it comes to diabetes, it is often associated with several other comorbid conditions too. Are there any new drugs for the treatment of diabetes which perhaps can achieve more than just glucose control?
Yeah, like you rightly said, the management of diabetes doesn't end with control of sugars. We need to look beyond. We need to address the prevention of long-term complications and especially organ damage. So, with this in mind, the quest for newer, safer, and better medicines is always, the quest is never ending. So we do have some drugs which are coming up in the last few years, which not only control the blood sugar levels but also give added benefit in the form of weight management, in terms of kidney function improvement, blood sugar control, as well as they help in improving the heart functions. We do have some other medicines which control blood sugar levels, and as well as at the same time they can control the cholesterol levels as well. So if you have diabetes, you can contact your doctor for these newer medicines and get more information about them.
All right. So there are newer drugs available, but like the doctor pointed out, contact your doctor and get an informed opinion on what drugs are best suited for you. Dr. Saran, which cardiac test should a healthy person regularly get done? And can, regular monitoring through these tests actually help prevent heart attacks or cardiac diseases?
Look here, what is a cardiac attack? It is basically the atherosclerosis. Atherosclerosis means deposition of the fat into the different arteries, which causes the blockage of the coronary artery as well as causes blockage of the cerebral artery. And after the 50 to 60 years, this atherosclerosis is supposed to block arteries up to a certain extent. But the thing is this, we never got any early indication that my artery is blocked. So what happens? Only that can be detected by the certain test, which has to be subjected if you want to have any security of your life. There's so many incidents happened in the past which has been, there is a sudden death. So what is the cause of sudden death? It is basically the blockage of the coronary artery into the heart or cerebral artery into the vein. If I talk about the heart, the CT angio is one of the answers which is non-invasive, where they will inject the dye and will subject you for the CT scan which gives a structure. And if there is an early obstruction in the coronary artery, that can be taken care of immediately by subsequently doing the proper invasive angiography. And after that, there are certain cardiac markers which I just told you. Watching on the cardiac markers every 6 months is very essential. Echocardiography every 6 months is very essential. So these are the cardiac markers, echocardiography and the CT angiography, if you are doing it. And I'll recommend like this: every birthday you are cutting your cake, you are having a party, and after that you must have a target to go for testing as well for your heart. And for the brain, I would like to supplement. For the brain, the thing is only to go and done the MRI, or if needed, the MRI angiography again, which is a non-invasive test. So after the age of 50 or 55 or 60, on every birthday, patient must be subjected for these cardiac as well as cerebral tests to ensure from any stroke or sudden heart attack.
All right, so regular monitoring there is something that is recommended. Dr. Sibul, last question to you, about insulin treatment. Now, starting and maintaining insulin treatment remains a challenge for millions of patients around the world. What are some of the new advancements in terms of insulin injections?
Yeah, so insulin therapy is the most natural way of treating diabetes. But the problem with insulin is that it is a peptide hormone. So if you take it orally, it will be broken down by the gastric juices which are present in our digestive system, and it becomes useless for the body. And because of this reason, insulin needs to be taken in the form of injections. Now the problem with injections is that there is always a fear of needles, there is a pain associated with it, and for these reasons the insulin is not so easily accepted by the patients. And until recently we just had the vial and syringe method for administering insulin, but now we have newer techniques, like we have the pen like device which is pre-filled with it's a cartridge based pen like device which has insulin inside it and a very small needle in front. So it's very user friendly, and it's almost painless for administering the insulin. Secondly, we have insulin pumps, which consist of an insulin reservoir which carries the insulin cartridge, and the insulin is delivered under the skin continuously with the help of a cannula. So these kind of devices also make insulin administration very easier. But the problem with insulin pumps is that they are quite expensive and not very user friendly, because patients need to be trained for the usage and for adjusting the dosages. But we do have these better options.
All right. Well, thank you, doctors, very much for joining us on the show.